Unpopular opinion. Adrenal fatigue may not be necessarily what we think about it. And in this video, we'll discuss some other theories why it actually may be adaptive mechanism for our body. We know from basic physiology that stress causes release of epinephrine and norepinephrine that are pro-inflammatory factors. We also know that glucocorticoids that are released from our adrenals are anti-inflammatory. In fact, we use glucocorticoids in medicine to suppress chronic inflammatory disorders. So, if patient has a lot of stress, whether it would be emotional stress or whether it would be environmental stress or even heavy exercises and heavy lifting also have been shown to cause a lot of inflammatory response from our body will release a lot of glucocorticoids to suppress that inflammation. So in all the literature about adrenal fatigue, they will call it as a stage 1 adrenal fatigue when you have very high levels of corticoids. But again, this is adaptive response for our body to too much stress. Later on, using the negative feedback loop, there would be so-called cortisol resistance, and our adrenals will not release as much glucocorticoids in response to the same inflammation or inflammatory reactions in our body. So that will be called stage 2 or stage 3. In some patients, they have infections that are not severe enough to cause a disease, but they are present in the body and causes some inflammation. Well, the body will automatically suppress release of glucocorticoids because it wants to increase inflammation and increase healing and immune system, so it will actually fight that virus. So again, this is an adaptive response from our body. It's not a pathological response in our body. For Google Medical School graduates, here is the link to the study that discusses that theory. And if you like this theory or if you're interested in learning more, follow me for more and share with others.